whole point of the healthcare bill is a big part of it is prevention. And we all know that an ounce of prevention is worth a pound of cure.
The Diabetes Prevention and Control Program at the Minnesota Department of Health, working off of a CDC grant, was able to really prove the concept of delivering the core curriculum of the Diabetes Prevention Program in a community-based model. And so they worked with YMCAs, churches, community centers, and others to train people on how to deliver that curriculum and doing it for a very low $10 a week.
I had read about a couple of programs, one in Minnesota, La Clinica, and one in Indiana that had been done through the NIH. And these are programs that worked tremendously, where it would, over a course of a number of weeks, an extensive period, take people who are pre-diabetic, and there's millions and millions of people in this country who are pre-diabetic, and this is something that's reversible, and basically just teach good nutrition and also exercise.
The National Diabetes Prevention Program will help to stop diabetes because it gives people a fighting chance to really prevent the onset of type 2 diabetes in a very real way. And it's been proven, we know that if you follow the curriculum of that program, there's a 58% chance of never having to go on to get type 2 diabetes.
You know, there's been a lot of talk about prevention and not much action. But now in the field of diabetes, we're really lucky to have the scientific research from NIH that says it works, and now we have the translation into the community level, the YMCAs, other community levels that show we can prevent diabetes and do it in a cost-effective way. We have the research, we have the facts, now it's time we all work together and get this done, and thanks to Senator Franken, we're moving in that direction.
Basically what it does is take these programs that have been successful and scale them up nationally.
One thing that's very gratifying about this bill is its bipartisan nature. The bill was introduced by Senator Franken and Senator Richard Lugar, a Republican from Indiana. Now, Indiana was one of the states that also helped to prove the concept behind this Diabetes Prevention Act. And so it's really gratifying to know that there's a strong understanding of the need to do this kind of prevention activity on both sides of the aisle.
If we can slow down the rate of people at risk for diabetes, developing diabetes, we're going to save the country money, we're going to save these individuals the suffering, we're going to have a healthier community, and we're all going to benefit.
I think we have an increased awareness. The trends have been all wrong, of course, but I believe we can reverse that, and I hope this plays at least a small part in that.
Minnesota is so lucky to have this involved medical community. We have researchers, we have clinicians, and now we are so fortunate to have Senator Franken step up and give us a real voice for advocacy at the national level. So this is such a great opportunity for us all to get together behind this Diabetes Prevention Act, and we really are fortunate to have Senator Franken on our team.